Thank you for joining us today. This is the Henry Ford Health System COVID update with Dr. Adnan Munkarah, Chief Medical Officer for Henry Ford Health System. Dr. Munkarah, thank you for joining us today.
Thank you, Tammy. Good afternoon. I hope that you all have been well and staying safe. I'm glad that you could join us this afternoon for the COVID update. I'm going to go over the next 5 to 10 minutes providing you some data that we have at the present time and some of the things that we are looking at over the next few days to few weeks, and then we'll be happy to take questions. Unfortunately, as many of you have heard, we continue to face record numbers day after day with respect to the COVID new cases. Nationwide, we hit 163,000 cases in the past day, and in Michigan, unfortunately, we continue to hit numbers that are very, very concerning, and that with the past 24 hours being at 6,900 cases. We are also starting to see an increase in the number of deaths from a national data perspective. We've had close to 1,200 deaths in the past 24 hours, and in Michigan we are seeing almost 50 deaths per day over the next week. Definitely very sobering data, and we continue to pray and hope that we'll make some headway and try to stop both the spread of the disease and death related to this disease. As we look at our data within our system, we continue to see an increase in the rate of the test positivity. So while we were in the single digit a few weeks ago when we were running a test positivity rate of about 2 to 3%, we are up now to 13% over the next few days. Our symptomatic emergency department and outpatient who are tested for COVID are almost at 33 to 34% rate. This means 1 out of 3 patients who are coming to the emergency department or to our clinics who are complaining of symptoms where we are suspecting COVID are testing positive at the present time. We are concerned that they might have exposure, and they are being tested. The positivity rate is about 10 to 11%. So definitely very concerning and reflective of what we are seeing both from a state perspective and national perspective. From a testing perspective also, we are starting to face some problems with shortage of testing supplies. Because of the surge that we are seeing across the nation and in the state, we are starting to experience some testing supplies and material. And accordingly, while we were having a turnaround testing rate of about 12 to 24 hours. In fact, 100% of our testing, we were getting back the results within 24 hours. This has now extended to about 36 to 48 hours because of that supply shortage. So definitely something that we need to deal with, and we are working diligently to make sure that we have the supplies, but there are things that are more of a national crisis and more of a problem that we are faced going forward. As far as our hospitalization within our system, we've had in the past 24 hours 307 patients who are COVID positive, confirmed COVID positive, and there were an additional 80 patients who are highly suspected of having COVID, who are either tested and the test result is not out there, or tested negative, but we still believe that they are COVID positive based on the symptoms and signs, and sometimes it takes some time for them to convert to positivity. The majority of our patients at the present time, or significant number of our patients, is at Henry Ford Macomb with 113 COVID positive patients at Macomb, but we also have seen a climb and an increase in the number of COVID patients across our hospitals. So we are now up to 60 patients at Henry Ford Hospital, and Henry Ford Wyandotte and Henry Ford Allegiance and West Bloomfield are in the mid-40s. Significant increase from where we were a few weeks ago. With respect to these patients, we continue to have a significant number of them needing to be in the intensive care unit. So about 22 to 23% of our patients at the present time are in intensive care unit. The number of patients who are on ventilators is definitely smaller than what we have seen in the spring. Part of that is definitely related to the fact that we are managing the disease in a different fashion today. In the spring, the belief at that time was that everybody needs to go on the ventilator early because it provides better outcome. We have learned that this is not the case, and accordingly, we are intervening with medical interventions, including high oxygen therapy before a patient is put on a ventilator. We are okay as far as ventilators. We do not, although we are utilizing many for COVID patients, but we are not concerned about any shortage in supply of ventilators. And in fact, we are acquiring additional ventilators for both Henry Ford Hospital and Henry Ford Macomb Hospital so that we are prepared in case we need them. We also understand that from a statewide perspective, the ventilators are not an issue as far as shortage at this point. There are about 1,300 ventilators in use for COVID patients at the present time out of 4,000 available. So this is definitely not a concern for us today. What are the concerns that we are having, and what do we think we can do to continue to manage this issue and this problem? We are very, very, very convinced at the present time that if we take the safety measure and mitigation measures that exist out there and that have proven to be beneficial, we are able to slow down the spread of this disease. This includes wearing masks. This includes social distancing. This includes hand hygiene. We have shown, and there is ample of evidence, plenty of evidence in the medical literature that shows that doing these things does help. And this is why we are very, very anxious to make sure that all our communities continue to follow these safety measures that we have mentioned. Unfortunately, we have seen a significant rise in number of COVID positive patients in community where the adoption of these safety measures have not been as good as we want it to be. We've seen it across the state as well in the Tri-County area when there is a lower adoption of mask wearing, social distancing, or limiting gathering, we have seen an increase in the number of cases in those communities, and we've seen a higher number of admissions and hospitalization in these communities. This is also significantly concerning to us because it's impacting our staffing. So unlike the spring, where the personal protective equipment, the PPE, were a significant shortage, today we share with other healthcare systems across the state as well as across the nation a significant shortage in staffing. Significant part of this is related to exposure in the community and people either converting positive or having to quarantine because they've been exposed in their communities. So this is putting a significant strain on the community and on the healthcare system to make sure that we continue to provide the care that we need to provide for our patients. We have continued to test our employees with very liberal criteria for testing them. We have had 10,000 tests in the past few months to our employees since we started implementing a more aggressive testing strategy in the spring. And out of these, 1,400 have tested positive, and this is over a matter of 10 months. The majority of these happened during our surge in April and May. We are seeing definitely an increase in the number of employees who are testing positive now. And on the average, for the past 6 days now, we have been averaging about 18 to 20 employees testing positive every day. The vast majority of these are related, again, to exposure into the community. So this is definitely a concern, and this is definitely something that we can stop and we can slow down significantly by taking the measures that we've talked about. And these are, again, masking, social distancing, hand hygiene, and limiting big gatherings. People are asking, are we still managing patients with non-COVID related conditions? And I would say absolutely yes. And the reason I am saying that is that we have learned during the first surge that delay of care in many, many conditions have resulted in unwanted and undesired outcomes with respect to these patients. Delaying cancer care, delaying care for cardiac conditions, delaying care for strokes or neurologic conditions, delaying transplant care or transplant surgeries, as well as other many interventions have caused significant effects that were negative on the on the health of our patients. And this is why at the present time we are committed to continue to deliver non-COVID related care as well as COVID related care. And we are taking all the measures and precautions to keep our patients safe, to keep our staff safe. And this is why we continue to do testing in a more liberal approach for every single patient who is coming for procedure, for pregnant women coming to our labor and deliveries. We've talked about testing in our staffing and for all our inpatients. We also are doing testing in the outpatient setting for any time there is suspicion of having a COVID, of people having contacted COVID. We have also, as I mentioned last week, our system incident command center has been active now for a couple of weeks, and we continue to meet 4 to 5 times a week through different committees and the incident command center to make sure that we are managing our operations across the system to allow us to take care of our increasing COVID patients, maintain the care of non-COVID patients, and manage our staffing on an as-need basis depending on the hospital needs. I've mentioned that we feel comfortable with where we are with our PPE. We continue to maintain a 100-day supply for PPE, and we have continued to manage our and we continue to watch our burn rate on a regular basis and make sure that we are replenishing the PPE that we are using. On some positive note, we continue to be very excited and optimistic about the possibility of a vaccine. So many of us have heard that Pfizer shared the news a few days ago that they have great positive results with their phase 3 trial on their vaccine. They have completed their phase 3 trial at the present time that has enrolled more than 43,000 volunteers around the world, and they have reported that the vaccine efficacy rate exceeds 90% 7 days after taking the second dose of the vaccine. These are extremely exciting news because it tells us that we have a light at the end of the tunnel. We also understand that Moderna is approaching getting some data and sharing some of the data, hopefully within the next 2 to 3 weeks on their vaccine. So there might be another vaccine that is also a successful vaccine. We are working closely with governmental agencies, both at the state level and the federal level, to make sure that we are prepared as soon as we get the vaccines. We understand that there are going to be specific indications of who get the vaccine first. Because of the limited number of vaccines that we'll be getting initially, the priority is going to be to people working in the healthcare settings who are at significantly high risk of direct and indirect exposure. And then from there, it goes to essential workers and then to people who are at high risk of developing severe COVID. This will be the first phase of the vaccine in the next few weeks when we get the first number of doses, and then we are able to escalate from that. It is expected that within the 2020, we'll have few million doses of the Pfizer vaccine. We don't have the exact numbers yet. These continue to be in flux, and we are waiting to hear from CDC what these numbers look like. And again, these are going to be allocated through governmental agencies, so are working closely with the state and the county regarding these numbers. We are also very excited that we just launched the J&J Janssen Ensemble vaccine trial. This is yet another trial in addition to the Pfizer, to the Moderna, to the AstraZeneca, with a very promising vaccine. This will be a one-dose vaccine, and this is again going to target people who are at risk, including all populations and diverse communities that we serve. So we are again excited about the possibility of having that vaccine on board, and we should be enrolling within the next few days. We already have data on our website for people who are interested to volunteer for that vaccine. We have completed our enrollment for the Moderna vaccine that we had opened a couple of months ago, and now we have another vaccine trial. This will be in addition to the Pfizer vaccine, hopefully that will be available to us soon through the federal agencies. The other thing that is also exciting to us from a therapeutic perspective, from a treatment perspective, is the fact that we'll have access to the monoclonal antibody by Eli Lilly. This is an antibody that has been shown that when it is given to people with mild to moderate symptoms of COVID. So these are people who tested positive for COVID and have symptoms and are giving that monoclonal antibody. That antibody helps with the earlier clearance of the virus as well as decrease in the number of hospitalization. This is also a monoclonal antibody that's going to be available to us, again, through governmental agencies, for the federal government purchasing it, deploying it to governmental agencies, and we'll be getting it also soon. We understand that this might be available, in fact, within the next few days, and we are also working as a system to make sure that we are deploying these treatments so that they are available for our patients as staff who will benefit from them. This antibody is going to be an intravenous infusion. So this is something that is going to be given into the vein and needs to be given in areas where we feel comfortable and safe that such medications are given. Last but not least, with respect to the treatments, we have continued to have 2 treatments that have shown efficacy in the treatment of these patients, including the remdesivir and the use of steroids, dexamethasone, in the treatment of these patients, and we continue to use these actively going forward. So while the numbers continue to climb, and where we believe that there are many things that we can do at the present time to slow down the spread of the virus, and I know you are going to get tired of me repeating that wearing masks, social distancing, as well as limiting gatherings and hand hygiene are extremely effective and are really important and critical measures for us to slow the spread of this virus. We are excited about the vaccine coming on board soon, and we are excited about having access also to the monoclonal antibody. Both of these will be available to our communities in the very near future. I'm going to stop here, and I'm happy to take questions.
Thank you, Dr. Munkarah. I don't see any questions in the chat. I see a message is being typed now.
Tammy, can I ask it verbally, or do you want us to put it in the chat?
No, go ahead, Ian. If you could please share your name and the media outlet that you represent. Hello?
No. Oh, I think I'm remuted. Can you hear me?
I can hear you now. Go ahead.
Hey, doctor. This is Ian Rhodes with WDIV in Detroit. We're hearing that you mentioned the numbers of patients increasing, but we're hearing that the ICUs may be close to capacity at 3 of the 5 hospitals. Can you comment on that? Do you know if that's true?
You mean in our hospitals?
Yes, in your hospitals. Yep.
So in our hospitals, our ICU capacity has been high even before, because we are having non-COVID patients. And when we look at the present time at our ICU capacity, and I'm trying to kind of look at our numbers, we are definitely up there into the into the upper 80s to 90%, which is definitely a high occupancy with respect to occupancy. So we are managing these on a regular basis, Ian, and we are also taking measures. So as we are planning our non-COVID related care, we are watching what we have as far as ICU capacity and making sure that we are managing these on a regular basis.
Thank you, Dr. Munkarah. We have a question too from Caleb Holloway. Caleb, what outlet are you from, please? If you could ask your question. I think he's on mute. Let me ask it for him. He said, what was the 307 people in reference to? Was that the number of COVID positive patients across all of our hospitals? And he's with NBC 25 News.
So yes, the 307 COVID positive patients are the inpatients across our hospitals, but I mentioned also there are an additional 80. So our total is about 387 patients currently who are either confirmed COVID positive per testing or suspected COVID patients across all our 5 hospitals.
Mm-hmm. Great, thank you.
Dr. Munkarah, could you talk about our ability to flex our beds according to the acuity of patients that are coming in, that we're just not limited to a sort of a finite, quote unquote, ICU bed number?
Yeah. So there are two things. Thank you for the question. There are two things we've done in the past and we've learned significantly from. Is one, surging our acute beds as well as surging our ICUs. And with respect to Ian's question initially, so although we are at 85 to 90% of our ICU bed occupancy, but we have a significant room to surge based on our prior experience that we have experienced in the spring. So that represents our current capacity without surging our ICU. And also there are some of our hospitals where we have the capacity to switch between acute beds, which are the regular beds in the hospital, and ICU beds. So we have some flexibility at the present time to manage ICU patients going forward. And just to put it in perspective, in the spring, we were at the peak of the surge. We had over 950 hospitalized patients with COVID throughout our hospitals, and about 25% of these were in ICU beds, and we were able to manage those patients. So this is why we feel comfortable with our capacity at the present time. We mentioned before, we want to maintain our ability to treat COVID and non-COVID patients. And this is why we are taking all the measures to kind of flex on a regular basis and determine what are our needs and when we need to expand beds.
Thank you very much, Dr. Munkarah. I see Charlie Ramirez has a question. Charlie, could you ask your question? Identify your outlet. Detroit News.
Sure, I'm Charlie Ramirez with the Detroit News. Dr. Munkarah, I was just wondering if you could speak a little bit more about the high number the system is seeing at its Macomb Hospital, and talk about, if you could, what is behind that increase. What do you think are the factors contributing to the big number there?
Charlie, what we have witnessed in the Macomb area over the past few weeks, that the number of positive cases started to increase before we have seen it in other areas. And from all the data that we have gathered and we have learned, that unfortunately this is an area where the compliance with some of the safety measures we've talked about was not up to par, was not the same as we have seen in other counties. So we believe what has happened is that we've had a significant spread in the community. That spread in the community that has led accordingly to more vulnerable population who are exposed to the virus, people needing to kind of show up to the emergency department and being admitted. So this is where we are trying to again share and educate our public that it is extremely important to stop the spread in the community, because we have seen that the spread in that community has led to increased admissions.
Thank you, Dr. Munkarah.
Thank you, Doctor.
We have another question from Sarah Sweck from Michigan Radio. Sarah, can you ask your question, please?
Sure thing. Hello. I was just wondering if you could tell us more about when your staff test positive for COVID, what the protocols are there, and how many staff do you currently have in quarantine or not working because they tested positive?
So when people test positive for COVID, they are asked to quarantine and be at home. Depending on their symptoms, usually these patients need to stay home until they are free of symptoms for at least 3 days, and also being away from far from a positive COVID testing for at least 10 days. So any COVID positive patient, COVID positive staff at the present time is asked to stay at home, and they need to be asymptomatic without symptom for at least 3 days before they come back to work.
Okay, and just quick follow-up, how many staff do you have that are currently off because they tested positive?
I do not have these numbers for you, Sarah. I need to check with our human resources where we are with the number of staff who are at home at the present time being quarantined.
Sarah, we can follow up with you with that.
Thank you.
I heard somebody else trying to ask a question. Go ahead, if you could identify yourself and the outlet you're with.
Yes, I don't know if you can hear me or not. This is John Hewitt with WWJ.
Yes, we can. Go ahead, John.
Thank you. My apologies. I was on another assignment and joined in progress. And I just, after hearing the governor yesterday, I was just hoping for the doctor's reaction in regard to the concern she expressed that if left unchecked, where we'll be 2 weeks from now. I did hear in the last few moments about ICU availability and the confidence that you feel you can handle things as they present themselves currently. But I guess down the road, if we don't stem this latest spike, just what concerns he has, and forgive me if it's redundant from what he shared earlier.
It is not redundant, and in fact, it builds on what we talked about. We are definitely concerned if the trends continue to be on the trajectory that we are seeing at the present time. Unfortunately, we are seeing in the past 3 weeks, we've seen a significant number of the patients who are admitted. And while we still have capacity, this capacity can easily be depleted if the slope of the increase continues to be at the same rate that we are seeing at the present time. So we are concerned that in the next 2 to 3 weeks, if we are not able to slow down the spread as well as the number of admissions, we'll be getting to capacity and we'll have to start limiting the non-COVID care that we provide. And this is not a situation that we want to be in by any means.
I had 2 other quick ones, not to monopolize, if I may. Anecdotally, and by no means am I an expert, but it seems early on in this, back in March and April, the virility of the virus, or at least the numbers of those that were dying as a result, seemed to be in greater number, even though deaths are increasing again now. Is there any reason medically? Is it because of treatment being refined and medical professionals know what they're dealing with more than they did 6-7 months ago? But it seems to be fewer fatalities, even though I know numerically they are still increasing. Is there any merit to why it seems less fatal, if you will, for a way to ask it currently than it did early on?
So probably this is related to a number of factors. One of them is the one that you have mentioned, that we know more about the treatment of the disease and how to manage it. So this is number one. Number two is that up till recently, the median age of the patients who are admitted to the hospital in the past few weeks was slightly younger than what we have seen in the spring. And we know that older patients, older individuals who get impacted by the COVID tend to have a worse outcome and a higher mortality rate. I just looked at the recent numbers, and the median age of the people who are admitted at the present time is increasing. So over the past couple of weeks now, we've seen an increase in the number of the median age. And this is definitely concerning, because as our elderly population and communities start being impacted, they might be impacted by a more severe disease. The third issue is that in the spring, we had a lot of our vulnerable population who were impacted, people who had many comorbidities. And we are hoping that at the present time, these people have continued to protect themselves. They continue to stay away from the gathering, try to kind of be socially isolated, and try to avoid to be in contact with people we have with COVID. And accordingly, the patients that might be coming in might not have all the comorbidities that we've had before. This is why we continue to promote people to kind of to do the social distancing we've talked about, to wear the mask, because we have seen that in the past, when we had the significant number of admissions and mortality at that time, and it impacted a significantly vulnerable segment of our population, we were able to get that under control when we used the measures we mentioned. So by hopefully taking these measures at the present time, we'll be able to spread this, slow down, and hopefully at some point stop the spread of that virus. Stop it from spreading to people who are vulnerable and who might be at higher risk to be sicker and die at a higher rate. As I mentioned earlier, what I'm hearing from our system as well as from colleagues across the system, at the present time, our ICU admission rate is still in the 22 to 23% of our patients who are admitted with COVID. So we are saying about 1 in 5 patients who are coming into the hospital with COVID are needing to be in the intensive care unit. We are not being as aggressive in placing them on ventilators as we were before, because we've learned more and we are able at the present time to use measures that we know that are more effective. So we've refined treatment, but we definitely continue to be concerned that if the numbers continue to increase and the vulnerable populations start to get impacted again, we start seeing an increase in mortality.
The last question, and again, I thank you for access and not to monopolize, but I'd be interested in what you would say anecdotally about staff morale. And by that I mean, I remember interviewing people back in March and April and how difficult things were, lack of PPE, and I know that dynamic has changed. But from those inside doing this work, seeing a second wave and maybe wondering why the public may not be taking it as seriously as they should, just anecdotally what those, in your profession are feeling in regard to having to deal with this second wave now.
Thank you for the question. And I can tell you that all of us are ever indebted to our healthcare workers who are on the front line and taking care of these patients day in, day out. They are doing amazing work. And if people talk about pandemic fatigue, think about pandemic fatigue about these people who day in, day out over the past 8 months now have been coming in to take care of these COVID patients, making sure that these COVID patients are attended to, wearing their personal protective equipment. Are they tired? They are. Are they emotionally drained? They are. And it makes it harder for them when they see patients that they are taking care of that contracted the virus because they might not have followed the measures that could have protected them. And at the same time, they feel that there is some element of exposure to these staff. So when they are exposed in the community, the pandemic fatigue and those emotional strains are even increased more. So this is why we are trying to support them. We can never say thank you enough because they've been amazing and doing amazing work over the past 8 months. In order to protect them, the best way we can thank them is by making sure that we follow the measures that can protect everyone, including our employees and our staff. And this is, if people really want to respect our healthcare workers, please follow the measures that we know are going to protect them and protect the community.
Thank you.
Thank you, Dr. Munkarah. You had mentioned in your earlier presentation about the vaccines becoming available in the next few weeks. I understand that the government distribution channels are being set up and they're talking about possibly spring. Could you talk a little bit about that?
So there are what we hear at the present time, and in fact, I was this morning on a phone call with the Michigan Hospital Association as well as Michigan Department of Health and Human Services with respect to that topic. What we know that we will be likely getting the first batch of vaccines in December. And I've heard anything, it keeps changing day to day, and I've heard anything between the first and the third week of December. These are going to be, that batch is going to be rather limited and is going to be what we call phase 1. This is the phase where we'll be able to dispense these vaccines and administer them for the healthcare workers who are at high risk for exposure. The other batches will start coming afterwards. It is expected, from what Pfizer has shared and what other companies have shared, that we will have, they are planning over 1 billion doses of vaccines in 2021. And some of it will be coming in the first quarter of 2021. And if another vaccine such as Moderna also comes on board, this will add hundreds of millions, if not more than that, to these vaccines. So there is no question, again, we'll continue to be optimistic, and this puts the smile on our face because this is where we believe we are starting to see the light at the end of the tunnel. That once we start having these dosages and that once we start being available at a community level, we'll be able to start sharing this and administering this at a higher percentage for our community. The data is very promising so far, and we know that there is concern and sometimes skepticism about these trials, but these trials are done in a very scientifically sound way. And none of these will be able to be advanced to where we need to without having all the safety measures to make sure that the vaccine is safe and all the monitoring to prove that this vaccine is effective. So I want to assure people that we are not going to administer vaccines that we believe are shady or suspicious because there is some political agenda behind them. This is not what we are going to do, and we are positive that there is significant and strong science behind these.
Thank you. And you said the Moderna vaccine has stopped recruiting, but Henry Ford Health System is currently recruiting for the J&J vaccine trial, correct?
That's correct. We started our recruitment for the J&J vaccine trial this week. And it is, people can go on our website and volunteer. We are accepting volunteer at the present time for that trial.
Okay. One other question. I don't see any other questions in the chat. I'm going to ask this though. You referred to the median age of those who, those with COVID who are in the ICU is climbing slightly. Do you know that number, that median age number currently?
Tammy, I don't have specifically regarding the people in the ICU. I'm talking in the hospital in general.
Okay.
And when I checked a little bit earlier today, about currently about 60% of people who are admitted to the hospital are age 60 or over. So starting to get up there in those, as far as those numbers.
Mm-hmm. Thank you very much for that information. I don't see any additional questions. Does anybody have anything they would like to ask Dr. Munkarah? With that, we'll wrap this up. Thank you so much, Dr. Munkarah, for sharing this very valuable information and insightful information about COVID-19. Thank you to our media colleagues for joining us today. We're signing off from Henry Ford. Thank you.
Thank you.